Hey sharpshooters, it's Kristen from Action Potential, and I want to take a minute to tell you a little bit about rotator cuff problems. So we often have patients come into the clinic who express pain when they're reaching overhead or perhaps lifting an object, playing a sport, and oftentimes that pain can be caused from a strain of a rotator cuff muscle. So in my little handy model here, this is a picture of someone's shoulder blade. This is the collarbone coming around to the front of their body, and this bone here is the arm bone coming down from the shoulder. The muscles that you see on the inside of the shoulder blade and the back side of the shoulder blade are the muscles that comprise the rotator cuff. Those muscles come from all directions within the shoulder blade to connect onto the actual arm bone. The job of the rotator cuff is to actually control how the arm bone is moving in the socket so that when you lift your arm up overhead, that bone doesn't press against other bones or other structures within the body. When we have a rotator cuff injury, oftentimes what happens is as that arm lifts, it compresses the tendon against the bone and can cause trauma within that tendon. That trauma causes pain and then limits your ability to move your arm. When you come for physical therapy to fix a rotator cuff problem, we emphasize helping to rehabilitate the muscles of the rotator cuff, as well as other muscles within the shoulder blade and outside of the shoulder blade to give you better stability within that shoulder blade to allow it to move correctly. So we certainly have a lot of tricks up our sleeves, no pun intended, when it comes to the rotator cuff, and we'll be happy to share those with you if you give us a call.